My name is Christine Ravelli. I'm an RN here at St. Mary's. I've been here almost 6 years, and I'm here really to get our public support on what's happening in our local hospital, specifically St. Mary's. You know, we've been in this pandemic over 8 months now. Initially made sense. We don't have everything we need. We've never dealt with anything like this before. But here we are 8 months later, and it's like we're still dealing with the same things, trying to get proper staffing, staffing up for this crisis that we are in. And it's maddening that we're 8 months into this and we're still kind of in the same place.
We are out here because the nurses at St. Mary's are demanding that St. Mary's does better. We are demanding that they do better in the aspects of PPE, that we be provided with every aspect of PPE that we need to keep not only ourselves safe, but our patients safe as well. We demand that with PPE, that they provide us with the education we need to properly wear the PPE that is being rolled out, instead of showing up to your shift, seeing a device that you're supposed to wear inside of a COVID room that you've never seen before. So you're quickly Googling to see, how do I wear this and what's the proper way to wear this so that you are best protected and that your patients are best protected. If nurses get sick, then who's going to be there to take care of these patients? We also are demanding that they follow our contract that was agreed upon on both sides. Putting nurses out of ratio, giving nurses unsafe patient assignments, puts patients at risk ultimately. It doesn't give us the time to give individualized care that we need to give to keep our patients and our community safe. People can definitely reach out to St. Mary's and ask questions, get involved, find out what's going on. The community support is everything to nurses.
Quality healthcare is vitally important for a healthy economy. Our nurses heal our workers so they can get back to business and life. The health and safety of our nurses is fundamental to maintaining a healthy economy. Nurses need healthy schedules, healthy patient loads, and safe working conditions, as well as quality, affordable healthcare that keeps them working so they can keep the rest of us safe and healthy. Prime healthcare must put patients and people above profit. We urge them to take immediate measures to ensure that the workers who provide healthcare have the safest, healthiest environment to which to practice. Anything less is a risk to our economy and our community.
Support your staff, support nurses at St. Mary's. We're fighting for patients, and we want St. Mary's to staff appropriately. Staff to ratios. These people are sick. These people need our care, and we're not getting that support from the hospital, so we're asking the public to support us, to put pressure on the hospital to do the right thing. They can do better. They can do better. They can do better, and they are not.